everyone, and welcome to the Amanda and Sarah Show. Today, on the show, we will be talking about the use of tanning salons. It has become a trend with many of our college students, and it's not very good for their skin. No, it's not very healthy.
So we've done some research, and we found that 59% of college students have reported using a tanning bed in their lifetime. So here with us today we have two visitors to teach us a little bit about tanning beds. First we have Julie Hamilton, who works at Santa Fe Tanning, and she'll be teaching us about the proper use of tanning beds. And we also have Dr. Ivy, and she is here to tell us about the health risks associated with using a tanning bed. So, hello Julie, how are you today?
Good, how are you?
Thank you for being here.
Yeah, no problem.
Are you finding that you're seeing a lot of college students in your facility?
Actually, yes, in fact we are. I find a big time that we have a lot of college students coming in is around spring break time. I think it's when they're going to be in their bikinis on the beach and they want to get a nice base tan for when they're going away on vacation. I think in society today, a lot of young girls find that a more bronze-looking skin is more attractive, and I think that's why we do see a higher volume of younger college students.
Right. Okay, so let's say that someone did want to go tanning. They did want to have darker skin. Are you able to give us some tips on how to be more safe in doing this?
Yeah, so the first thing we do at Santa Fe Tanning Salon is we give them a chart, and it's a skin assessment chart, and it just gives us a base of where to start for how long each session should be for them and which tanning bed they should be using, because each tanning bed is actually equipped differently for every skin type. So that's one thing we do. Another thing we have is spray tan, and we find that with spray tanning it still gives you that nice healthy looking glow that people are trying to get. But it also keeps the skin from being exposed to UV ray effects.
Great, those are some great alternatives to tanning beds as well. Thank you.
Mm-hmm. It seems that you brought some type of lotion with you today. Can you tell us a little bit about it?
Yeah, so I brought this. It's called Dark Star. It's actually for indoor tanning. We do have it at Santa Fe Tanning Salon. So with the lotion, it has tanning agents in it. And we just find that when lotions have the tanning agents, it keeps our customers from having to come back so often and using the tanning beds, just so that if they're not using it so often, then their skin doesn't have to have the drying out effect that the tanning beds can do. And the lotion does keep their skin more hydrated. It's actually a policy at our tanning salon to use the lotions. As well, we also make sure that our customers are using goggles.
Wow, that is awesome to know. Thank you very much, Julie, for coming here, meeting us with today, even though I know you must be very busy.
Oh, no problem. It was great that you had me.
Thank you. And we're off on our commercial break. See you in a short while.
If you keep tanning, indoors or out, the effects of harmful rays will show up on your skin. Wrinkles, age spots, and an increased risk of melanoma, the second most common cancer in women 15 to 29. Stop tanning. Time may not be on your side. Learn how to protect your skin at spotskincancer.org. A message from the American Academy of Dermatology.
Welcome back, everyone. So now we have with us Dr. Ivy. Hi, Dr. Ivy.
Hi.
How are you doing today?
I'm good. How are you?
I'm good. Thank you so much for being here with us. Before the break, we were talking to Julie a little bit about wearing goggles and how that's a policy in these facilities. Can you tell us why it would be so important to wear these goggles and what risks are there if you aren't wearing them?
Thank you very much for that question. But first and foremost, I want to appreciate these institutions that have these policies put in place for their customers, that they have to wear goggles and use lotions before using the tanning beds, and I really appreciate that fact. Ultraviolet rays do affect the eyes, and if the eyes are not protected properly by the use of eye goggles, you could have eye cancer. And some of the eye conditions that you develop could be temporarily, could be treated, but others like the chronic eye conditions such as the cataract can actually impair vision. And yeah, with excessive exposure to ultraviolet rays.
That's
Wow.
very interesting. Well, thank you.
I had no idea. I personally enjoy tanning, and I know a lot of people out in our audience enjoys tanning also. I was wondering if you can tell us a little bit of the side effects from tanning.
Well, yeah, we have other issues, side effects that are associated with excessive exposure to tanning, to UV radiation. It's not tanning that is actually the problem, but actually the overexposure to ultraviolet radiation. You have issues that could cause what we call photoaging. This refers to the aging of the skin, and you see youngsters that have wrinkle-like skins and have sagging skins. This is because of due to excessive exposure to ultraviolet rays. And other issues that could be associated with tanning would be that the institutions do not put in place proper infection control, that is by disinfecting or wiping off their facilities between users. So infection could actually be transmitted across users. And another misconception that I have to talk about is the misconception that teenagers and college students have concerning acne and blemishes. Well, most of them think that tanning beds could cure their acne, but I would advise them as a doctor that they go see their dermatologist first for a proper prescription or diagnosis for the treatment of their issues. And another thing that I would love to pass a message across to our youngsters is that over excessive exposure to ultraviolet rays can cause skin cancer known as melanoma, and that is a very serious issue.
Wow, that's some pretty scary stuff there that you're talking about. Can you tell us a little bit more about the skin cancer, like some of the early signs of skin cancer and how we would be able to identify it on our own bodies if it did develop?
Yeah, thank you for that question. First and foremost, when the skin is exposed to UV rays, enzymes that are triggered from the body to go treat this damage. But most of these enzymes actually do not repair the damaged skin. What they do is that they mutate and can increase the risk of skin cancer, such as melanoma, like I earlier mentioned. And according to Skin Cancer Foundation, just one severe burn during childhood, or a total of 5 sunburns in a lifetime, doubles the chances of melanoma. In fact, the use of burning and tanning beds before age 35 increases the risk of developing melanoma by 75%. And we have, for you to assess, like you had earlier asked, assess for skin cancers, we have the ABCDs of skin cancer. And the A stands for asymmetry. This is for you when you're assessing your skin, if you notice any mole, to you assess if the size is the same in both sides. And you have the B stands for border. You're checking if the mole is jagged, if on both sides if it's not smooth, kind of. And then C stands for color. You're assessing the color of the mole, if it has different shades, like black or brown, or some of them could have white, blue, then that could be an issue. And the last of it that you have to also know is the diameter. If it is over 6 millimeters in diameter, that is an issue. And if you notice such on you, I would advise you to go see your family doctor or a physician.
Wow. Well, thank you for tuning in with us. We're just going to do a quick review of what we learned today. Now remember, when you go tanning, to always have lotion with you, to wear your tanning goggles, and to always check for your ABCDs for your skin. Till next time.